teachers are our number one target. Teachers, school nurses, school administrators, that's who we want to target. 99% of the services that these children need and the rehabilitation they need is going to occur in a school setting. That's the way things work in this country, and that's the way it should be. Teachers are, most of the time, more than willing to learn about this and want to learn about it. So there are programs that have been developed by some colleagues out in Oregon to provide wonderful online training for teachers to go in and in 25 minutes learn a bit about what brain injury is. And there are a number of resources of teachers who can go out and work with special educators to really understand what brain injury is and what it does. There's actually a program out in California where they're actually incorporating brain injury into their special education teaching curriculum, which is one of the first in the nation to do this, which I think is because of kind of the growing awareness of what this problem.
Challenges of students with TBI. Prior to the IDEA Act of 1991, children with mild TBI were often denied services because of delayed onset of symptoms, misdiagnosis, transition, communication between hospitals, parents, and educational institutions. The psychoeducational assessments were inadequate, often only testing students with TBI's IQ, not examining information processing, the cognitive deficits, and failure to provide correct intervention and diagnosis. A deeper look. Identification and misdiagnosis. It's reported that 20% of the children in an ED classroom have unclassified or unreported traumatic brain injuries. They often go untreated and ignored. TBI, although it has similarities to LD and EBD, emotional behavior disorder, TBI is an acquired disability. Some TBI patients never recover their lost function. TBI students struggle with information processing, attention, processing speeds, memory, and behaviors are dramatically impacted from their traumatic brain injury. However, they can process previous information, but often unable to retain new information. TBI patients often remember their life before TBI, which causes social, emotional, and behavior issues for students with TBI.
Well, in terms of emotional and behavioral changes that occur, most brain injuries in a traumatic sense occur affecting the frontal lobes and the temporal lobes. And your frontal lobes are the part of the brain that have what we call the pleasure center and the initiation center and the sort of attention distractibility center. And then the temporal lobes have a lot to do with memory as well as emotional control. So you're hitting those areas, or you end up isolating those areas from being able to do things. So a number of kids will be more apathetic than anything else, or they'll just sort of sit there like a bump on a log and not really do anything. They tend not to get recognized particularly well in school because they're not a troublemaker, because they're just sitting there. Of course, they don't do very well at school, but they're just sitting there. Then there's the group where their ability to stay on task is quite impaired, and so they'll get up and be fidgety and wander around the room and not stay on task and get distracted by the bird flying by the window, the noise outside, all kinds of things like that, and again, don't pay attention enough to know what's going on, may not even remember, because they haven't paid attention, that they were being told to do a certain task, so they don't even know to do it. And other kids find them kind of distracting. Teachers really tend not to like kids to do that. So then they get disciplined a lot. The third group that have a lot of trouble controlling their emotions, and we all have trouble controlling our emotions to a certain extent, but their abilities, like almost non-existent. So they can be in the classroom and then all of a sudden get really, really angry, or suddenly start laughing or crying, and there doesn't necessarily seem to be any correlation to what's going on around. Maybe something happening internally, something that they're remembering about what happened at home, but all of a sudden you're having to deal with a child who is out of control, and what are you going to do and how are you going to manage that child? So there's that, and then of course there's the combination of any of the above. And then because of the memory problems that you can have, you get further behind in school. Well, if you have the awareness to realize that you're not the same as you were from before, and that you used to be a really good student, but now you're not doing as well and you're not remembering, whereas before it used to be like that, then that can get really frustrating, which can then make you really angry or get you really down. And then a brain injury in itself gives you a risk of being depressed just because of the brain injury about 70% of the time. So depression is a factor as well. And then the pleasure center of the brain, if it's isolated, puts these kids at great risk of becoming substance users and addicted, because the impact of that substance, the impact of the alcohol or the cocaine or whatever, is going to be like 5 times greater than what it would be to another kid. So they're going to get a super high and become almost immediately addicted. So then it's really important to try and get them to avoid using those substances. But most kids get into using those substances because it makes them feel good about themselves, and when you're not feeling good about yourself, it seems pretty natural to head towards it. And the people who tend to start using substances as a kid tend to be kids who are having trouble in school and are sort of socially isolated. And a lot of kids with brain injuries become socially isolated because they're not learning and they don't interact with their peers the same way as their peers do. They're a little slower at understanding jokes and understanding what's cool. They just don't quite get it. So there's a lot of sort of emotional, behavioral things that you have to deal with.
Before intervention, students with traumatic brain injury. Effective educators examine the learner. What age did their injury occur at? Their individual recovery process and independency. Their instruction strategies, accommodations and modifications. Their curriculum content. Will it be presented concretely or abstractly, depending on the student's deficits? And the environment. DPI provides a checklist. That checklist examines orientation and attention to activity, a student's starting, changing, and maintaining abilities, absorbing and retaining information, their ability in language comprehension and expression, their visual perceptual processing, the ability to use visual motor skills, the sequential processing, problem-solving, reasoning and generalization, organization and planning skills, impulsivity, social adjustment and awareness, emotional adjustment, and sensor motor skills. It is imperative that an effective educator working with students with traumatic brain injury involve the student in the process. Present with simplicity, plan their environments, pre-teach the strategies that they're going to use with their students, rehearse, recall, and repeat.